Hey, my name is Dr. Sean Price. I'd like to thank you for watching this video. I want to take a couple minutes just to invite you to come to our next workshop, which is coming up next Monday. And it's going to be on GERD or acid reflux or heartburn. And the reason we're doing a workshop on this is because the majority of our patients that we see that are chronically ill have some sort of digestive issue. And one of the most common digestive issues that we see is heartburn or acid reflux or GERD. And what happens is when patients start developing these symptoms, they actually end up on some sort of medication like a Tums or Rolaids, or even something more intense like a proton pump inhibitor such as Prilosec, or one of these medications like this. And those medications may provide relief in the short term, but they actually make the problem worse. And one of the things that we're going to talk about in this workshop is we're going to talk about how acid reflux and heartburn is actually caused by too little stomach acid in the majority of the cases. So that's one of the first things that has to be determined. Is it truly too much stomach acid, or is it actually too little stomach acid? And what will happen is if you have too little stomach acid, the food will go into your stomach and it won't break down fully. And when it doesn't break down fully, then what happens is you end up with undigested food, and it doesn't leave the stomach as quickly as it should, and you end up with putrification. And when you have that putrefaction mixed in with what little acid you do have, that can cause acid reflux. So then you take some of these medications, whether it's prescription or over the counter, you take some of these medications and they make the acid feel better because it reduces that acid content, but it's actually making the problem worse because it's already too little stomach acid, so it propagates the problem. And one of the things that we're going to talk about in the workshop is how GERD and how acid reflux are not just a digestive tract issue. They can and very often do become systemic issues for a lot of patients. And the mechanism of that happening is when you have undigested foods and they get into the digestive tract, they get into the small intestines and they go through the assimilation process, these undigested foods start getting into your system and your body doesn't recognize them. Your immune system doesn't recognize them. So that causes an immune activation. And when the immune system activates, it can become hypervigilant. So you can start having these autoimmune responses. So this immune activation, it can happen in several areas of the body. One of the areas is the gut. You can end up with chronic inflammation in the gut. You can end up with irritable bowel syndrome. You can end up with leaky gut syndrome, things along those lines. You can end up with activation actually in the skin. You can end up with weak hair or brittle hair and weak nails, and you can end up with rashes and rosacea, and sometimes even psoriasis can happen as a result of activation of the immune system and results of the skin. Also in the lungs, it's very, very common for acid reflux and GERD to lead into asthma for a lot of adults. So that's another thing that can happen, in activation of the lungs. And what many people don't know is that it can actually lead to activation in the brain again as well. So situations such as vertigo or balance disorders, short-term memory loss, chronic pain syndromes, things along those lines can be a result of this activation because of an immune response to these proteins getting into the system that the body does not recognize. Hashimoto's disease is another thing, the thyroid issues. There are all kinds of issues that systemically can happen if you have heartburn and acid reflux and you don't handle the situation, and they can especially happen if you make the system or the symptoms or make the malfunction worse by taking these proton pump inhibitors and these antacids. Another thing that can happen is when you have decreased hydrochloric acid, it can lead to chronic inflammation in the body. So your pain gets worse. You start just feeling inflamed and achy and everything hurts. It's just systemic inflammation. So these are just some of the things that we're going to cover in this workshop, and these are just some of the reasons why heartburn is not just heartburn. Sometimes we'll eat something that might give us a little heartburn, and you get through that and it's fine. But if you're one of those patients that are suffering from chronic heartburn and you're on these medications, again, whether it's prescription or over the counter, you're on them daily, it could be leading you down a path to greatly diminished health, and you need to figure out what's going on, how to fix it, how to handle it without the medication, and so your body can restore normal function. So we're going to go over this in the workshop. We're going to go over many more issues that can come up from it. But most importantly, we're going to tell you what you need to do, what the next step is to help you recover and get past this without using medications. All right, I hope to see you at the workshop. Again, that's going to be this coming Monday. And we only have room for 15 people in the workshop. Space limitations, the workshop is in our office here in Walton Beach. So you can call the number that's posted in the article that came along with this. If you call that number, it's a 24/7 recorded hotline. The seats are reserved in the order that they are received on the voicemail. So give us a call immediately, reserve your seats, and I hope to see you Monday. Have a great day.